Hello and welcome to Beyond Dilution, the official podcast of Srimati Chandaben Mohanbhai Patel Homeopathic Medical College, one of India's most oldest and most respected institute. The institute etched in the history of homeopathy, where tradition, teaching, and true healing come together. This initiative is born out of a simple intention, that is, to move beyond potencies and prescription and to explore more on sciences of homeopathy, philosophy of homeopathy, and lived experience of homeopathy. Through this platform, we aim to bring together clinicians, academicians, researchers, and students to reflect more on what homeopathy means in today's world. Allow me to introduce myself. I'm Dr. Prachi Singh, your host for today, Assistant Professor at C.M.P. HMC. And the very first topic for today is to gain more insight on what homeopathy means in today's world. To talk on this very first topic, we have with us a very distinguished guest, a senior practitioner with over 41 years of clinical experience. He is the master of homeopathic philosophy, professor at C.M.P. HMC. Please welcome none other than Dr. Prabhakar Devadiga. Welcome, sir. It's a pleasure to have you.
Thank you, Dr. Prachi. It's my pleasure too.
So let's begin. And let's begin with a very simple question. We know that many people know about homeopathy, but they may not fully understand it. So if you had to explain homeopathy in one simple sentence, what would that be?
It is the most simplest, most reliable, and the easiest way of healing.
Simple but powerful. In spite of that, if you see and Google homeopathy online, you will come across a word called as pseudoscience. Now, what do you have to say to people who have just Googled it 5 minutes before seeing this podcast?
See, Wikipedia is one viewpoint. It is not the final authority on the subject. Now, homeopathy is based on nature's law, which does not change over a period of time, over the centuries, and hence cannot depend on the changing opinions, because that's a trend. Now, anybody who comes to me who are having Googled and comes to me in the OPD or clinic, I would say, I do not accept this label of pseudoscience. Do not fix the label on me. Go through the philosophy, go through the history, and accept the view of millions of people who have benefited from this science.
Absolutely.
And those people who have benefited are the true followers who are regularly seeing the results.
They are the best judge.
They are the best judge. I would like to add, homeopathy was the first therapeutic method in the Occidental world to show the relation between the medicine and the disease.
So if you could explain what Occidental world means.
Occidental world is the new world, what we call as European and the American world. Oriental is us, Asian, India, China, Japan, etc. Okay. All the medicines are proved on healthy human beings, which now is a criteria for all the system.
Absolutely.
Okay. There is another thing, what is that holistic, the detailed case taking, what we call constitutional, is today's personalized medicine.
Right.
Not only that, the constitutional symptoms which we are taking are the epigenetic traits. Now, epigenetics is in a big way now, and we have been finding about it so long. The question which comes in the pseudoscience is that our medicine is very small dose. With nanotechnology has proved it beyond doubt. The research based on nanotechnology, where we are able to find 30 and 200 potencies too, on cancer cells with gelsimum and conam, has proved that it brings about apoptosis in the cancer cells. Now, I think we do not need to keep on proving it is a pseudoscience or science.
Absolutely, sir. So this, what they're talking about, the epigenetics and nanotechnology now, it has been conceptualized in our literature centuries ago.
True, you just writes about the cell lining 100 years ago. And we teach that to our students.
So it's only a matter of time that science then starts observing, and then with the advanced technology, they start proving it.
That's true. Hahnemann was a mystic who got it first. The science has to trod and actually find it and comes to the conclusion later, which is a normal phenomena.
Yes, absolutely. Today we see an explosion of chronic illnesses in our OPD, right? From autoimmune disorders to metabolic disorders and even long-standing viral influences. You have such a vast clinical experience. If you could explain us what role homeopathy has in helping in this chronic illnesses and improving the quality of life and wellness of the patient.
Okay, let me tell you. Before antibiotics were discovered, homeopathy was used largely in United States. Once the antibiotics came, the medical world thought that we have been able to fix up all the illnesses, which as we all know that there are so many diseases which does not require antibiotics, and there are chronic diseases and chronic infections too.
Correct, correct.
Hahnemann was the first person to write a theory on chronic disease after 32 years of experience. And he came to the conclusion that we have to move from quick fixes to long standing support of the patient who suffers, continues to suffer, remains helpless.
Right.
So he requires a better quality of life and resilience to the disease.
Right.
So he can be living a comfortable life for a long time of period. The concept of constitution which came in, right, which talks about the various triggers, various causes,
Correct.
and various responses of the person, which will decide the outcome of the disease.
Right.
So, when a patient of chronic disease comes in, we try to entail the details of the person and try to fit a remedy which has been proved on healthy human beings and then prescribe to him to get the better response to the same triggers. So, let me give an example. A rheumatoid arthritis, a patient who is suffering from a lot of pain, has been given a lot of medications. Sometimes those medications work and sometimes the medications have their own side effects. Sometimes it does happen. The patient feels helpless. He is neither able to take the disease or not been able to take the symptoms of the side effects. In such cases, when we take the detailed history and when we prescribe, the person is able to do his day-to-day activity in a much better way. The quality of life improves, and that is what millions of people have been taking advantage of this science. Our OPD is filled with so many patients who are coming with chronic diseases,
Right.
and we see them responding. Sometimes my students very interestingly ask, "Sir, why is this patient coming for so long?
Absolutely. I know.
Are you a bad doctor?" No. We say the patient is getting that relief and he is comfortable. It does not have a side effect. So many times it so happens when I tell them that for sometimes we may not require medicine, the patient does not want to. Then we tell them there is no need for medication and convince the patient that we will try without medicine.
Right.
This is what homeopathy is. Today, the chronic disease definitely outnumber acute disease. Therefore, homeopathy is leading with example about treatment of chronic disease.
So to summarize, what I understood is homeopathy treats not the disease, but actually the person in the disease.
Absolutely. Right on.
Sir, our institute, C.M.P. Homeopathic Medical College, and our hospital, Sri Mumba Devi Homeopathic Hospital, has created generations of physicians. What do you think has our college and institute contributed to the field of homeopathy and medicine at large?
See, our institutes, Srimati C.M.P. Homeopathic Medical College, is a pioneering institute since last 70 years, established in 1956, and teaching students. At a time, we had 8 generation of teachers here in this college. You can understand how it is propagated outside. Our teachers here are at national level speakers. They are involved in syllabus. Their books are widely read and they are there in the syllabi of our universities, NCH and foreign universities too. When they teach, our students go out with that confidence and able to practice. And some of them have gone on to teach at various levels world over. So that spreading of homeopathy is definitely there. At Sri Mumbadi Homeopathic Hospital, you can see the queue for yourself. And the number of patients who come here from all over come with only the reason because we not only give good treatment, but we also give honest opinion on the scope and limitation of homeopathy. That is why people come with that good faith.
Right.
They spread the awareness, and the students who learn from these patients are going to go out with so much of confidence that they are going to treat millions of patients outside. And that is what I would take as the contribution of our institute to the field of medicine,
Right.
field of homeopathy at large.
Talking about contribution, I think the patient flow per day is in hundreds.
That's true.
That itself speaks about the contribution of our science, at least, to the world outside.
I would like to think so.
So now I have a tricky question.
Okay.
Whether homeopathy is complementary medicine or competitive?
Neither. The health minister once said that if you have two daughters, I can't call one as a daughter and second as a complementary or alternative daughter.
Okay.
So we believe to be part of integrated as equal partner in the field of health. Hence, we take all what is there in the modern science as to offer, and we are applying it today, the principles, to bring about cure. As given in aphorism 1, our aim is to restore sick back to health.
Absolutely.
So, no competition,
No complementary.
no complementary, integration.
Integration. So, as we come to the close of this conversation, what message would you like to share with our young practitioners and students who are just beginning their journey with homeopathy?
I would say stay curious, stay grounded, and stay true to the principles of homeopathy.
Right.
Do not listen to the opinions and criticism. Listen to your patients, to your teachers, and to your own experience.
Absolutely.
That will help you to move forward.
Right.
And today, future of homeopathy depends on those doctors who have got love for the system, have compassion, and who are honest. Remember, the true wealth is the smile of the patient who feels relieved and who gets treated when they come to us. There is no wealth beyond this.
Absolutely. Absolutely. Thank you so much, sir, for sharing your wisdoms and insight into homeopathy.
Thank you.
Thank you, listeners, for joining us on Beyond Dilution. Until next time, keep questioning, keep learning, and keep healing gently. Thank you.